drug chart, click on the Prescribing tab in the Patient menu on the left-hand side. This shows the full drug chart of all prescribed medications, feeds and supplements including IV therapy. The drug chart is laid out in a very similar way to a paper drug chart, so you will find sections for once only, stat doses, regular medications, PRN and fluids. The prescriptions are listed in alphabetical order and you can see details of the prescription in this box here. The medication name, dosage route and rate, if applicable, are displayed here. The doctor or pharmacist may include extra information such as formulation or whether the drug is stock or named patient in the additional information box here. Due doses are shown as white boxes in this area of the chart. You can see the times they are due on the sides of this section. When a dose is due and within the administration window, you will see a large green pencil inside that box. To sign for a medication, click on the pencil and you will see a drop-down menu of options for the administration. Select the relevant option for this administration. For example, if you gave the medication as prescribed, select one and press OK. There are a number of choices for circumstances, including the patient refusing the dose, the patient not being present, or the withholding of a dose due to clinical reasons. Once you press OK, you will see your initials in the box as your signature. A dose that reached the patient is displayed as white with your initials. A dose that didn't reach the patient is displayed as red with your initials inside. There must always be something recorded for each dose, even if the dose did not reach the patient. If there is no signature or initials, this will be considered a missed dose. You may also use the comments box to put in any additional details. For example, if there was an associated test result or observation related to this dose, or to record the actual route of administration if the patient has the choice of two. If you press on the letters, you will see the history of who and when that dose was given, as well as any detail recorded in the comments box. If you've made an error and selected the wrong option, or if the patient vomits their dose, and you need to amend the dose administration, you can do so by clicking on the initials and then pressing the edit button to change the option. Please note, if any changes are made, this is visible in the audit history, so it may be useful to use the comments box to record the reason for any changes or discrepancies. For a controlled drug, where a dose requires a counter-signature, you can sign for it in much the same way. However, you'll be prompted for a second staff member to countersign the dose. Select the second staff member's name and they will need to enter in their own password and press submit. You then see both of your initials in that box. Insulins also need to be countersigned. You'll be able to begin signing for medications administered within a defined window of when the medication is due. This is from 2 hours before the medication is due up until 10 hours afterwards. It is important that you sign for administrations at the time of giving the medication so that the system is live and accurate. Any late signatures will be able to be tracked and audited. After the 12-hour period, that dose will be closed and locked and the dose will be recorded as a missed dose.